Hello everyone. So today I want to chat about the combined oral contraceptive pill, otherwise known as the birth control pill, the pill, what have you. So the combined oral contraceptive pill is a varying combination of the estrogen component being the ethinyl estradiol and then the progestin component. And progestin is kind of this umbrella term used to describe a wide variety of different synthetic compounds that act similarly to progesterone in the body. So the combined oral contraceptive pill, just to reiterate, is an ethinyl estradiol plus a progestin. So with this large variety of different combinations of the ethinyl estradiol at varying doses, as well as combined with different progestins, you have a lot of options. So if you currently are on a pill or have been on a pill, have tried it, didn't like it, there's lots of options. So whether you're having breakthrough bleeding, your skin's getting worse, mood's getting worse, you're just not tolerating it well, it is worth switching it up, mixing it up, and finding a pill that works for you. It could just be tweaking the progestin or which progestin is being used, or tweaking the ethinyl estradiol component of that. How does the birth control pill work? So with respect to the contraceptive component of it, you're coming in with this exogenous hormone. So exogenous being from outside the body versus endogenous being hormones your body produces. So these exogenous hormones, so the ethinyl estradiol as well as the progestin, they're coming in and they're actually doing your body's hormones work for you. So they're at these higher doses that are suppressive to your endogenous hormones. So you have the ethinyl estradiol and the progestin running your cycle for you, taking you through that monthly kind of hormonal exposure and then withdrawal, leading to a cycle. So with the suppressive action of these hormones, you're actually not going to ovulate each cycle. So if you're not ovulating, you're not producing an egg. Without an egg, you can't get pregnant. Contraception. So that's how that component of it works. How does the oral contraceptive pill work for skin? So some women are on this for acne, is one of the more commonly prescribed reasons that women are actually on the birth control pill. So with acne, we have, again, if it's a hormonal acne, it may not work if diet's going to be a factor, or may not work as well. But with the acne, again, you're suppressing those endogenous hormones, so you're not getting estrogen, progesterone, and specifically testosterone. So without those circulating as they should be in your system, there's less testosterone to then act on those cells in your skin that upregulate oil sebum production, causing acne. Another component of how it works for acne is it actually upregulates something called sex hormone binding globulin. So this is a protein produced in the liver. It responds to these exogenous hormones. Your liver upregulates it, so there's actually more of this protein to then bind up your sex hormones. So again, less circulating hormones, there's less of an opportunity for it to act on your acne. That being said though, some women go on the birth control pill and their acne actually gets worse. That's going to come down to the progestin component of the birth control pill, and that's a whole other thing in itself. I'll dive into that in a different video, I think. We'll kind of leave it at that for now. And then another reason women are on the birth control pill would be to help regulate PMS symptoms, severe cramping, heavy blood flow. So how does it do that? So you have, again, the ethinyl estradiol being the estrogen component, and then you have the progestin component. And these pills, you're constantly exposed to the progestin, the progesterone acting component, for the whole month. And so progesterone, as we know, it counteracts estrogen. So this progestin component actually lightens or lessens how much of an endometrial lining your body is able to build. If there's less of an endometrial lining to build or built up, there's less of it to shed, resulting in lighter periods. And typically if there's less of an endometrial lining, your uterus isn't working so hard to actually shed that. So that can be a reason why women are on it, is the pill actually lightens their period. Another question that commonly comes up with respect to the birth control pill is, does it affect my fertility? So this is a long answer, but in the short, no, it does not. There's no studies that have found that the pill directly impairs future fertility. That being said though, it depends on why you go on the pill in the first place. So for some women, they're on the pill to help regulate cycles. They have hormonal imbalances that the pill then suppresses, and your cycles look normal when you're on the pill, but it's really the pill doing it for you. So if you're on that for 10 plus years, take away the pill, your endogenous hormones are still going to be imbalanced, or what they were 10 plus years ago when you first went on it, and that in itself could impact fertility. So it would be, when you come off the pill, then you kind of have to do the work to get things rebalanced. So when you're on the pill, there's no good way to truly assess what or where your hormones are at, predict future fertility. There's no way to do that with these exogenous hormones in play. So to summarize, I really wanted to just give an overview on how the birth control pill works, the components of it, and just common reasons why women are put on it, and kind of the mechanism behind how it actually works for those common reasons. I think it's important to know how what you're taking is actually working and what it can be doing to your body. If you've listened to my previous videos on estrogen and progesterone specifically, and all those functions that those do for your body, I do think it's important to know that when you're on the birth control pill, you do not get the benefits of your own estrogen and progesterone. So that is something to consider. The birth control pill is, it's very well studied, it's widely used, it works well, we know it works for contraception. I think there's a time and a place for it, definitely. It may not be for everyone. Some women don't tolerate it, some women do tolerate it. What I do think is important to know is that there are options. There are many other birth control options, and I think it's important to be presented with all those options, and unfortunately I don't think a lot of women are. So it is important to ask your healthcare provider those questions, know your options, know what and why you're taking it, and if it's the best thing for you. So please feel free to comment any questions you do have on this topic. Note, I cannot give you direct medical advice online, but that being said, I hopefully can point you in the right direction towards other articles, other blog posts other doctors have done, or at least maybe give you some questions that, if you don't really know how to articulate what to actually ask your healthcare provider with respect to the birth control options, that would be a place, or those would be some questions that I would be able to answer. So I look forward to hearing from you.